What's possible when technology is built for social services? Mareto is Canadian-built case management software for the social sector. In this quick demo, you'll see how teams can bring intake, case management, events, and funder-ready reporting into one connected system. In many organizations, the work doesn't fit the technology. Clients end up repeating their story, information lives in different systems, and reporting takes time away from frontline work. Mareto was designed with social services in mind, so your team can track multiple services in a single client record, manage cases and events in one place, and report outcomes with real-time dashboards and exportable reports. Here's what makes Mareto different. It's fully customizable. Every form, workflow, dashboard, and report is configurable to match your needs. It's one person, one profile, so clients can access multiple programs in a single record. You get funder-ready reporting with real-time dashboards and exportable reports. Role-based access ensures staff only see what's relevant to their role. Mareto is Canadian-built and hosted, with full data sovereignty, and it's designed to be easy for frontline staff to use. In this demo, you'll see 5 quick chapters: home and navigation, central intake, case creation, events and outreach, and finally reporting and strategic insights. Let's start with the home screen, the first thing you see when you log into Mareto. This is your command center for the day. When you log in, Mareto greets you with a personalized homepage. At the top, you'll see quick action buttons, so your team can jump straight into adding a new person, creating a case, logging a shelter operation, starting a daily log, booking an appointment, or posting an announcement. The center of the screen shows today's overview, a live snapshot of what's happening right now. You can see intakes, active cases, cases closed today, incidents, room checks, and bed checks, all updated in real time. On the right side is the special announcements panel. This is where managers can push important messages directly to staff, like updated protocols, policy reminders, or urgent notices, so everyone sees it the moment they log in. On the left, the navigation menu gives you access to every module in the system: central intake, case management, shelter, outreach, daily log, appointments, reporting, and your strategic insights dashboard. Now let's look at central intake, the starting point for every new person who comes into contact with your organization. When you click into central intake, you land on the call log. Right away, you can see a live count of total clients, in this case 24, along with 2 built-in summary charts. One showing diversion results and one breaking down immigration status. These give your team an at-a-glance picture of who's coming through your doors. Below the charts is your full intake list. Every client logged with their name, date of birth, the date and time of their intake, the staff member who completed it, the referral source, follow-up date, safety status, and contact information. You can sort and search across all of these columns to find exactly who you're looking for. To log a new client, you just click New Client and the intake form opens up right here. It's organized into tabs so the conversation flows naturally. The first tab is basic information. You're capturing the person's name, date of birth, gender, preferred name, phone, email, location, race and ethnicity, referral source, income source, and which staff member is completing the intake. You can also flag whether this person was diverted and note a follow-up date. The Safety tab captures contact method, home and current location, immigration status, whether it's safe to leave a message, and whether any risks have been identified. Diversion and housing digs deeper, asking whether this is the first time the person has experienced homelessness, where they stayed last night, what they're looking for, and what their main reason for leaving their last housing was. Support needed captures the barriers making it hard to find or keep housing, what resources the person already has, whether they're getting help from family or friends, and whether they have an income. There's also a checklist for next steps, things like whether the person was diverted, whether a safety plan was attached, or whether an outreach referral was sent. You can also attach a photo directly to the intake record. And there's an additional information tab for anything else your team needs to capture. Once you're done, you save the record and it's immediately added to the call log, searchable and visible to any staff member with the right access. Next up is case management, where you turn an intake into an active case and start coordinating the real work with your client. When you navigate to case management, you land on the case management system overview. At the top, you can see 2 summary tiles: your current caseloads and active incidents, so managers and caseworkers always have a live pulse on their workload. Below that is your active cases list, showing every open case with the primary person, case name and number, case status, the unit or room they're assigned to, the caseworker responsible, and the goals set for that case. You can also toggle over to close cases to review completed files. To create a new case, you click New Case. The case form pulls in the client's existing profile on the right-hand side, so you can see their personal information, race and ethnicity, income source, and even their photo, all without having to re-enter anything. This is that one person, one profile approach in action. On the Case Information tab, you give the case a name, set the case status, assign start and expected end dates, link it to a program like Transitional, and assign a caseworker and supervisor. Everything is searchable so your team can find the right person or program quickly. The Health Information tab lets you note the reason for homelessness, flag any allergies or health issues, and add important alerts that caseworkers should be aware of. Case Documents is where you attach and track all the paperwork tied to a case. You can select the document type from a pre-built list, things like government-issued ID, health card, birth certificate, status card, consent form, assessment or intake form, referral letter, and medical report. You set the date it was signed or completed, add an expiry date if needed, and upload the file directly. Case Goals is one of the most powerful parts of the case record. You select the goals you're working toward with this client from a pre-configured list. Options like securing stable and safe housing, accessing income or disability assistance, increasing community connection, navigating health or mental health services, rebuilding personal identification, developing daily living skills, engaging in employment or training, supporting cultural identity and indigenous wellness, enhancing personal safety, and strengthening confidence and self-determination. You can select multiple goals and add notes to track progress. And the Case Closure tab is there when the time comes to formally close the file. Once you hit save, the record is created instantly. And you're back on the case management overview, where the caseload count has already updated to reflect the new case. Now let's look at how Mareto handles the day-to-day operational side of running a shelter, from bed management and incident reporting to outreach events, daily logs, and appointments. Starting with the shelter module, this page is auto-populated. No manual entry required. It gives your team a live view of your occupancy rate, available beds, occupied beds, and average length of stay, all updated in real time. Below that, you've got a side-by-side view of occupied beds and available beds, showing exactly who is in which room right now, along with when that assignment was last updated. This means any staff member coming on shift knows the current bed situation at a glance. Under Shelter Operations, you can expand to see sub-modules for bed check, room check, shift log, and incident reports. This is where your team logs the operational events that happen every shift. The Shelter Operations list shows all logged events, their type, subtype, and timestamp, so nothing falls through the cracks. If you open an incident report, you can see the full detail. Incident type, severity level, location, context of what happened, witnesses, and whether emergency services were called. Every incident is documented, timestamped, and tied to the relevant client records. Moving over to the Outreach module. This is where your team logs outreach events, recording what items were distributed, whether emergency services were needed, the quantity of items provided, and the total number of participants reached. It's a clean, simple way to track community outreach activity and report on it later. The daily log is a shared communication tool for your team. Staff can post updates, flag concerns, and even tag colleagues directly using the @mention feature so the right person gets notified immediately. Think of it as an internal message board that keeps everyone on the same page across shifts. And finally, appointments. The Appointments module gives you a full client appointment list on the left, showing the client name and appointment date. On the right is a live calendar view, so you can see what's coming up by month, week, day, or agenda. Appointments are color-coded and linked directly to client records, making scheduling and follow-up straightforward for your whole team. We're wrapping up with what might be the most powerful part of Mareto: reporting and strategic insights. This is where all the work your team does every day turns into data you can actually use. The reporting module gives you a live summary right at the top. Total call logs, active cases, occupied beds, and average length of stay, all in one view. Scroll down and you're into intake reporting. Here you can see your diversion result data visualized as a slope chart, showing outcomes across categories like immigration status, main reason for leaving, race and ethnicity, shelter entry, and safety concerns triggered. Each chart has a live filter built right in, so you can slice the data by any field to get exactly the view you need, whether that's for a funder report, a team meeting, or a policy review. Keep scrolling and you get into more breakdowns, like main reason for leaving shown as a pie chart, and shelter entry as a bar chart. These are all live, all filterable, and all based on the data your team is already entering in their daily work. Then you hit case management reporting with metrics like closed cases, average case length, case-by-case status, and case goals. This gives managers and funders a clear picture of outcomes and throughput. Now, the Strategic Insights dashboard is something different entirely. This isn't just a report, it's an AI-powered narrative dashboard that reads your data and tells you what it means. When you land on it, you see it's organized into tabs: who's calling, safety concerns, shelter operations, and a 30-day action plan. The opening view is called your intake system at a glance, showing the same headline numbers, but now with plain language explanations of what they mean for your work. Scroll down and you see diversion success tracking, breaking down what percentage of calls were partially diverted successfully, or where diversion was impossible for safety reasons, with a plain language explanation of what each number means. Bed utilization sits right beside it, showing occupied rooms, availability, and occupancy rate in a format you can paste straight into a board report. Further down, the dashboard highlights race and ethnicity data, and importantly, it flags data quality gaps, like when a high percentage of cases are missing demographic information, and tells you what to do about it. This kind of built-in accountability is rare in case management software. And at the bottom, you see what clients need to exit crisis, showing the service goals your clients are actively working toward, ranked by frequency. This is the kind of strategic intelligence that usually takes hours to pull together. In Mareto, it's always there, always up to date. Survey dashboard. Finally, the survey dashboard lets you run satisfaction surveys directly within Mareto. You can see the survey questions, the response breakdowns, total surveys completed, and export the raw results. It's a clean way to capture client and staff feedback without needing a separate tool. So what does it actually take to get up and running? Here's how onboarding with Mareto works. It starts with a workshop where we map your workflows, define your customization needs, and build your implementation roadmap together. No two organizations work the same way, so we take the time to get it right before we build anything. Step 2 is configuration. Our team builds your forms, sets up your data tables, configures your dashboards, and designs your analytics to your exact specifications. You don't get a generic system, you get Mareto built for how your team actually works. Step 3 is data migration. If you're moving from spreadsheets or a legacy system, we handle that transition for you. Your historical data comes with you. And step 4 is training and go live. Your team gets manuals, tutorials, and hands-on training sessions. So when you go live, everyone is confident from day one. There's no dropping your team into a new system and hoping for the best. If you're ready to see what Mareto can do for your organization, visit mareto.ca to learn more or request a live demo. We'd love to show you what's possible.